individuals and communities to prioritize menstrual health and well-being. To set the tone for today's discussion, I would like to invite a very important and experienced personality who has so many years experience in public relations, as she was the PRO for the Greater Accra Police Regional Command and subsequently became the PRO for the Volta Regional Command of the Police Service. She's currently the Director of Public Engagement of Parliament of Ghana, and then she would be giving us the purpose of this session. Ladies and gentlemen, she's no other person than our very own Superintendent, Mrs. Effia Tenge, retired. Director, you have the floor.
All right, thank you very much, Valerie and Mustafa. Let me say good afternoon to you all, and thank you very much for joining our honorable members of parliament and our resource persons who have joined us this afternoon. Let me once again thank you very much for making time of your very, very, very overloaded busy schedules to join us this afternoon for this very important conversation. Yes, it is important that Parliament of Ghana, we don't become oblivious of what is happening around us, and that we also get to speak and also contribute to discussions on menstrual hygiene and health. Ladies and gentlemen, let me say that Parliament of Ghana has evolved over the years, and for an institution that does not evolve will definitely die. And so that's become important that we are committed to being open Parliament and also in line with international best practice. And for some of the commitments with our open Parliament module or concept, we can talk about the three key pillars, which has to do with transparency, accountability, and the very most important thing, which is the citizen participation. And all these three important key pillars would always have a driver, which is the innovation and technology. And so for Parliament having come this far, we believe that if we are having such a conversation, then we can also explore the many ways by which we can continue to reach out to our publics, particularly the youth groups. And so it is for this reason that we are having this conversation with our youth groups today. On 28th of May, Parliament in its own way made a statement on the floor of the House. And beyond that, we still believe that we can still continue to have an inclusive conversation where we have you also participating in this kind of very healthy conversation. Then we can all have a very fruitful dialogue on our menstrual hygiene. We also can say that menstrual periods are natural with women. And so if we look at the SGDs, the very things that would prevent girls from going to school, then we as Parliament, members of Parliament, are very interested in their collective effort to ensuring that some of these obstacles are mitigated so that our girls can go to school. And so today, we intend to hear from our members of Parliament and experts in this area for them to discuss this very important topic of menstrual hygiene and health. And let me thank Valerie and her team for eventually making this possible. Let me once again, on behalf of the clerk, the speaker, and everyone, welcome you to this conversation. I won't take much of the time. I'm not to do the talking this morning or this afternoon. Rather, we are leaving it in the hands of the experts and also our members of Parliament. And so let me once again say that you are very much welcome to this webinar, where we continue to explore on the topic menstrual hygiene and our menstrual health. Thank you very much, Mustafa.
Thank you very much, Director, Superintendent Mrs. Effia Tenge, for that wonderful remarks. Indeed, we now know the purpose of today's session, without wasting much time, I'd like to introduce a senior public relations officer with the Department of Public Engagement to introduce our guest speakers for today's session. And she is no other person than Miss Valerie Nalamyoko Boy.
Thank you very much, Mustafa. Thank you so much for the kind words. Honorable members, adroit and distinguished facilitators, ladies from our Youth Impact Parliament, YIP, and some men, friends of the media, my name is Valerie Nalamyoko, and I am honored to serve as your co-moderator with Mustafa for this interactive session on menstrual hygiene and menstrual health. The focus of today's engagement is demystifying menstruation through an in-depth understanding of menstrual hygiene and menstrual health. But before we dive into our main agenda for today, I wish to take a moment to acknowledge all those that have logged onto this platform. I recognize that many of you are keen to hear from our exceptional panel of leaders and professionals within the medical field, and they will be sharing their invaluable insights during this session. So let's kickstart things by introducing our esteemed speakers and highlighting their remarkable achievements, each one deserving of recognition. I would like to start with the Honorable Hajia Zuwera Mohammed Ibrahimah, an accomplished member of Parliament for the Salaga South constituency. Proud to join in politics, Honorable Zuwera worked in various sectors that involved her dedicating her life to community development, public administration, and diplomacy. Honorable Zuwera is a distinguished politician and humanitarian who makes a significant impact in her role. She holds a Bachelor of Arts degree in Management Studies from the University of Cape Coast and also an executive MBA in marketing from the University of Ghana. Beyond her legislative duty, she is a powerful advocate for youth and women empowerment, further solidifying her position as a leader committed to making a change. Let me just add that we are very blessed and fortunate to have two Hajias on this panel. First, Honorable Hajia Zuwera. The next is Honorable Hajia Fatahiya Abdul Aziz, Member of Parliament for Salevugu constituency. Hajia Fatah exemplifies a profound commitment to youth and women development, as well as security and intelligence within the close protection specialized area, a fundamental aspect of her professional narrative. A significant element of her vision involves the promotion of political advocacy, fostering engagement that transcends beyond political affiliations. She continues to advocate for women's empowerment, youth development, education, and social justice. Can we kindly mute our microphones, please? Can we kindly mute our microphones, please? Thank you. We equally have with us Dr. Entry Jemfi, co-founder of the Medics Limited. She's a health project management consultant and an occupational health and safety consultant with over a decade experience in the practice of medicine. She has managed several health projects across West Africa. In Ghana, she serves as the head of operations subcommittee for both the Ghana Electronic Pharmacy Platform Project and the National Electronic Health Systems. The next speaker is Mr. Archibald Adams, an experienced international communicator and advocacy specialist with more than 17 years of practice. His working experience is with both the public and private institutions, including the Ghana Broadcasting Corporation, Reproductive Health Rights, Planned Parenthood Association of Ghana, Ghana College of Nurses and Midwives, and currently as the public engagement lead for Oxfam in Ghana. Thank you so much for your attention, and I welcome all speakers to today's engagement. I would like to start off by introducing our main speaker, Dr. Maame Fuwaa Entry Jemfi, who will be talking on menstrual management. Doc, you. Hello, Doc.
Hi, thank you, Madam Valerie, for the kind introduction, and good evening to everyone. I'll just share my screen now. Okay. Can you see my screen, please?
Yes, we can.
Thank you. Okay, so I'm going to kick off this discussion on menstrual hygiene and health talk with menstrual management. To start, I'll just define what menstrual management is, which is essentially clean and safe methods to absorb menstrual blood, maintaining hygiene, and ensuring comfort and dignity. So the importance here is that we are talking about blood products that are coming out of the body, okay? So this is not just a blood product, but we appreciate that menstrual blood contains the blood and then the inner lining. So that's the light wall inside the uterus, the womb of the woman, that is shed every month or periodically, okay, over a certain number of days. It varies for various women. So we can understand that there are hygiene issues here. And if this product is not collected and disposed of well, we also have safety issues because most of us live in communities. So it's not even just about the fluid coming out of you, which is familiar with your body and your system, so it's okay for you. But what about other members of your community who may come into contact with these products if they are not disposed of properly? So it's essentially about clean and safe methods to absorb menstrual blood, maintaining hygiene, and then ensuring the comfort and dignity of the female involved. Now, the essentials for good menstrual management. The menstrual products to be used must be safe and hygienic. Clean water and soap is necessary for the hygiene and the safety components. Women need private spaces to change or to fix or replace these products. Information about menstrual management should be accurate, and then women need a supportive environment. The types of menstrual products that are commonly on our markets are disposable pads, we have reusable cloth pads, tampons, menstrual cups, and then we have period underwear. The further slides would go into further detail about these. Before I start, however, I want to talk about the vagina and the uterus. This is the female reproductive organ, so that we all have a clear perspective on the parts of the woman's reproductive anatomy that is involved in this. Okay, so what we hear is the female reproductive organ. Okay, when we say the womb, we are talking about this, most of us now starts from here of the womb, which is more or less the outlet or the end of the womb. It's what we call the cervix, okay? So all the inner components here to this part, the cervix, let's put an invisible line here, across here, okay? So this is the womb. Now, when we talk about a lot of things to do with men and menstruation, these things are either external, okay? So down here will be what you see outside, which are the lips of the vagina, okay? So things like a sanitary pad just sits out here. You put it in your underwear out here. It doesn't go anywhere inside over here, okay? So to a large extent, it's fully external. And then there are some other menstrual products that are in, a lot of women have concerns because they believe once you are inserting something, you are in the womb. But the assurance I want you to get, anything you insert, menstrual products, the whole tract that it is going into is the vagina. The menstrual product and the vagina is a very long tract. You understand? If we are talking about the fact that even when people are having sexual intercourse, the penis remains in the vagina. It doesn't get into the cervix. In the same vein, all of that. It's single use, it's disposable, and to a large extent, it doesn't require much to clean when the pad is safely disposed. Now we have reusable cloth pads, and this is absorbent fabric placed externally in under. Still use fabric that they fold to a thickness that they think will be enough to absorb their menstrual flow, okay? And even globally, it is still accepted to use reusable cloth for collection of menstrual fluid. The advantage is that it's eco-friendly and cost-effective. It's soft, it's comfortable. The disadvantage here is that it requires washing and drying. You can imagine that this is very subjective. Some may have to do it more than others, and it may not be as secure. So it may shift if not secured properly. So you can see over here that the type I have displayed, which is the more
recording in progress.
The type I have displayed here, which is the more modernized version, you can see their attempts to create fastness at the end, so that in some way you can secure it to the edges of the underwear to keep it stable. However, you can imagine that people traditionally fixing cloth, it may shift, and then you can have women soiling themselves, which is not very comfortable, especially in areas where we still have a lot of stigmatization. Now we have tampons. And tampons are menstrual products made of absorbable material inserted into the vagina to absorb menstrual fluid. So this is traditionally here, you can see a clean tampon. So all of this is absorbable material. In most cases, it's cotton. And then it has this thin thread or cord attached to it. So this is essentially how it is removed after it has been inserted. Most tampons, and for most women, even though you see it as this maybe thin and light, it's actually also designed according to thickness. So that some women, they have lighter flow ones, and there are some for heavier flow. Now, when you come here to this image, where you can see the uterus that I showed, and you safely see the tampon is lying all the way along the length of the vagina, okay? So you push it in, and then you have these cords lying over there. That would typically just stick out of the vagina, but it's short. It's nothing that is uncomfortable. Tampons can stay usually for about 12 hours, which means that most women who use them can use it for an entire day. If you decide to fix a pad, whether it's disposable or reusable, chances are it may be displaced, it may shift, and you have a lot of these challenges. But with a tampon, you push it in, it stays in the whole time of activity. You take it out when it's time to change it or at the end of your menstrual cycle, and you're good to go. The disadvantages of using tampons, though, is that in cases where they are overused, not change intervals as they are supposed to, infections. And one of them is toxic shock syndrome, which is commonly associated with tampon use, okay, when you don't manage the safety and hygiene aspects. So someone will just fix it, leave it in, sometimes for days, just because they're light bleeder, it's not soaked, so they want it to stay in. Those are the circumstances under which tampon use will predispose you to infection. You can also appreciate that it requires proper insertion technique. For most people, in the when they need to insert, they may like to lie down and make sure it has been fixed properly, which may sometimes be an inconvenience for somebody who is on the go. It can be done, but you need to be very familiar with the process to insert it properly on the go. So that is it for tampons. Now the next is the menstrual cup. In this case, it's microfiber polyester, and it absorbs menstrual blood during a woman's menstrual cycle. So you can see this underwear here, emphasis on this part, where you see an inner white lining, which is not just the regular base of the underwear, but it has been thickened to accommodate menstrual flow. The advantage is that it's comfortable, discreet, it's good for women with light flow, and it's reusable. It's also good backup for other menstrual products. So there are women who probably are not sure if other menstrual products will be absorbent enough for them. So in addition to that, they wear these period underwear as backup. And there are women who actually just have flow light enough, so they use just the period underwear. The disadvantage, though, is that it needs regular washing and it can be expensive initially compared to the cost of regular underwear. Now that we've gone through the menstrual products, we need to highlight on the hygiene practices with menstrual management. Washing hands before and after use of menstrual products is important, especially with soap, to change when necessary. There's no fixed interval for change because women's intensity of menstrual flow vary. Somebody may need to change every 4 to 6 hours. Somebody may need to change every 12 hours and the like. Wash and dry reusable items properly, and then the disposal of menstrual products. They should be wrapped and they should be disposed in bins. A lot of women sometimes insert menstrual products in water closets. So in a lot of public area washrooms, you may see signs now just reminding women that not to flush, but to dispose of menstrual products in bins. It's important because most of these are not degradable in bins. Now, when we talk about menstrual management, and to be honest, all of these are important, or they fit in well when you track your menstrual cycle. Because imagine you've bought any of these products I have discussed, but you are not very familiar with your menstrual cycle. What that means is the products will be in your bag, but you saw yourself even before you get to enjoy the benefits of any of the products discussed. So it's important for women to track their menstrual cycle. You need to know your cycle so you can prepare in advance. And it's also important for women who are tracking their fertility and health. Tools you can use now are digital and manual. So with the manual tools, people journal. They actually record the dates that they have their periods, whether they want to know their safe sex periods or they want to know how to prepare adequately with their menstrual products. Fortunately, there are lots of apps now that help people track their menstrual cycle too, and facility, Flow, Clue, and then people also use period calendars. Now, the challenges with this menstrual management that I've gone through so far, one, we have product unavailability, where the options may not be available to women, and then they suffer with menstrual management because maybe the only one at their disposal, for example, which may be reusable cloth, is not adequate for them because they have water challenges as well. And these things require regular cleaning to change, okay? Other issues with product unavailability may be that it's available, but it's unavailable to the woman because of the cost of it. Another is stigma and myths associated with menstrual products. For example, if you think of products like tampons, there are lots of myths around them, and even use of menstrual cups, where some people believe when some Hi, can you hear me?
Yes, Dr. Khan.
Yes.
Okay. So I was discussing the stigma and myths using menstrual products. For example, in the case of tampons and menstrual cups, which are the ones you insert, There are some communities where people believe that once a woman uses a tampon or a menstrual cup, it means she's not a virgin because you can only use it once your hymen has been broken. So you have stigmatization just because of your choice of menstrual products. But from what I showed you, the image, you can appreciate that where we are even inserting some of these products to a large extent, it can be inserted safely without it necessarily coming into contact with your hymen. So these are still safe products, so the stigmatization around it with education can be managed. The next is poor sanitation, where in certain areas, women do not even have a lot of waste bins available to them for the safe and maybe private disposal of some of these products. And then other challenges with management may be that if you're not using a product, that does not make it easy for you to go about your activities of daily living. What I mean is maybe you are using pads, but the one that is available to you is not absorbable enough. So what it means is whenever you are menstruating, you're literally bound indoors because of the fear of soiling yourself when you go out while you're menstruating. And the last is the emotional impact of menstruation and sometimes the isolation that comes with it in certain periods. So people do not even request the information that would make the management of their menstruation more dignifying for them. Some empowering solutions would be, for example, as we are doing now, to educate at school, work, and community, to provide free, low-cost or subsidized menstrual products, to improve sanitation for women, and then to promote support systems for women who are menstruating or in the community for menstruation. Now, the role of the youth and society is to, one, break the silence and make it easy for women to inquire, to gain or access knowledge about menstruation, to show empathy. In that case, it means that when women are also having challenges, and the barrier here is a knowledge one, they can be supported or assisted so they are more comfortable during their menstrual periods, to advocate for change, which is for example, as I described that in some community, certain options of, or certain choices of menstrual products are literally not accepted or they are frowned upon, because in those cases, women are not even given those options, whereas they may be the best ones for them. And then last one, to support menstruating peers. I mean, for some, you may know, and even sometimes when you have a partner who is menstruating or a relative who has menstrual syndromes or menstrual issues, you know the time within which these things come up. So to create a more supportive environment for menstruating peers. So finally, I'd like to say that menstrual management is really a right. It is not a privilege. So let's all strive to promote dignity and shame of menstruation, and then ensure safe and hygienic periods for all women. Thank you.
Thank you so much, Doc, for this insightful presentation. I am glad you touched on the issue of stigma and myths when it comes to the use of some sanitary products. So now we know better. Let me also borrow the words of yourself in your presentation and encourage all of us to join hands to break the silence by breaking that stigma as well. I entreat us all to kindly reserve our questions, suggestions, feedback, and comments for when the last speaker is done with his presentation. In the interim, we can type our questions in the chat section, and at the appropriate time, all questions and comments will be addressed. Let me also add that we are live on the Parliament of Ghana's Facebook page. Kindly follow us, like, comment, and leave a feedback. Thank you. Given how limited our time is, I plead with our distinguished speakers to stick to the allocated time of 10 minutes for their presentation. My next speaker is the Honorable Hajia Zuwera. Honorable, we are ready for your presentation. And she'll be speaking on understanding the menstrual cycle. Sir?
Hello.
Hello.
Hi, good afternoon.
Good afternoon, Honorable. Thank you very much for this opportunity to share thoughts on this very important subject. Menstrual cycle is all about. Let me say that the menstrual cycle, as we've all tend to call it, actually begins when we get a period or menstruate. Now, the period itself comes about when hello. Hello. Hello.
Please, we can hear you.
Good. So when the monthly shedding of the lining of the uterus occurs, then we have what we term the menses, which constitutes partly blood and some tissue, which we excrete from the body through our female private part, the vagina. Now, this flow usually starts with women when young girls when they are poverty. In some cycles, it's as early as 8 years, 9 years, all the way to 16. If a young girl is having puberty. Now, between this period, any young girl can start to menstruate. And typically, girls will start menstruation around the ages of 12, 13. But at all times, and typically, at least by the age of 15, every young girl would have experienced their first period. When that doesn't happen, up to age 16, then clearly there's a problem. Because what it means is that at the end of the menstrual cycle, which ranges between 24, 28 to 35 days, the womb is prepared to receive the egg. The egg, which travels through the fallopian tubes, gets awaiting a sperm to fertilize, and then when it fertilizes, it descends back into the uterus to implant. So when that doesn't happen during that period, that the menstrual cycle, the hormones have made the uterus linings thicker in order that it can receive the egg. Then the uterus has to shed the lining, which comes out with blood and tissue. Now, most people during the month of menstruation will experience some symptoms. Some of it will include cramps. It occurs when the uterus is trying to expel the lining. So most young people complain that they having cramps in the cervix area. That means that they are getting ready for a period. Some get headaches, others even food cravings, bloating. I used to bloat a lot time during my menstrual cycle. So bloating and sickness in some very extreme cases. Some young girls will even vomit. Some will be bedridden until the period is over. So these are some of the things that accompany this natural and biological cycle of a woman. Now, typically, a period should last between 3 and 7 days. But for some women, it could be more than 7. But if it's anything 8, 9, yeah, that could be seen as normal. Anything beyond 8 and 9 days clearly is abnormal. And such a woman will have to seek medical care. They need to be talking to their doctor
about that condition. Some of the menses, the period, also come very light, so that if a woman within that period, instead of shedding blood, sees only spots or drops of blood, clearly there's something wrong with their cycle and they need to seek medical help. The other example of the abnormal menses would also include long periods, heavy bleeding with clots. Some women bleed with heavy clots, and in those instances, they need medical attention. There are other women who will also bleed 1 month, the second month, no bleeding, third month, no bleeding, and yet they are not pregnant, because menses should occur when a young woman is not pregnant. So when that happens, then clearly there's a problem and the woman needs medical attention. For a long time, I think that the issue of women and periods has been treated like a taboo subject. But I think the more we speak about it, the more we get society to understand what a period is, the more we take away the stigma, the ridicule that comes with this situation. There are times that even young girls are shy to mention to their friends that they are in their period. That shouldn't be. There is nothing that what God has ordained, that every month we go through the cycle. We don't have the power to stop it. And so it has to be received. Society has to accept that this is normal for women. And so in the event that even a young girl, which happens sometimes, soils herself during this period, because there are times that, yes, young people do and should do. After the first period, the second period, you know when to expect your period. So within the first 3 periods, we are all able to tell that, oh, my next period will come at this time. That's what we call the fact you know when to expect your period. Sometimes maybe someone didn't track or they forgot. And not a basis for anyone to ridicule them or to make their life uncomfortable. Once women track effectively their menstrual periods, then they are able to control what they do. And I think that is also part of the reason that sometimes the young ones, especially in basic schools, they know that the period is coming, they're expecting it at this time. Then they stay away from school because they are afraid that they might soil themselves and then their classmates will make fun of them or call them names. We need to get everyone out of that mode. Things will happen. It doesn't matter how much education we have, it doesn't matter how many sanitary pads we have, it doesn't matter how much we can afford, but mistakes can happen, overflows can happen. Maybe someone, usually the first day, the blood doesn't flow much. On the second and they sold them. So we need to be confident. We build their confidence and then they can stay. What they are making, it is something that they have to endure as young people. So this cycle continues throughout a woman's menopause comes also the ages where people still differs. For some, it even comes early. For others, it comes very late. Either pregnant or they are sick, and they need to get medical attention. But once we are come the second month, it doesn't come the third time, clearly we have seen menopause. And that also comes with its own set of other what do you call it, difficulties, because people put on life. It's a very important part of our everyday conversation to get our society to accept the cycle of a woman, makes the woman's life change depending on which cycle she is in. By age 8, some young girls start developing breast. They start developing pubic hair. They've changed. So you'll find that they begin to hide their private bodies. From that point, we need to engage and let them know that they don't have anything to be ashamed of. This is how it's meant to be. We need to prepare their minds for what is coming after they attain puberty. We need to walk them through the various stages of the menstrual cycle. We need to prepare them on how they should take care of themselves when menses comes. Menstrual hygiene is very critical because in one moment you are shedding blood, the next moment how you manage that can also directly affect your own well-being. So the cycle is natural. We cannot stop it. We can only encourage our girls to manage it and manage it properly. Most importantly, we need to get society to accept, kill all the taboos around this, kill the stigma around this, and let us accept this as a natural, biological cycle for women. I want all young people listening to this Zoom to feel confident when they begin to menstruate. They haven't done anything wrong. There are no cases. It is just how God meant it to be. Thank you very much for having me on this program.
Thank you, Honorable. Can everybody hear me, please?
Yes, we can hear you, Ms. Valerie.
Yes, we can hear you.
Okay, let me use this opportunity to remind us all that we are live on the Parliament of Ghana's Facebook page. Kindly follow us, like, comment, and leave a feedback. Thank you. My next speaker is the Honorable Hajia Fatahiya. Sorry about that. I lost connection for a while, for a bit. My next speaker is Honorable Hajia Fatahiya. She will be giving us okay. Am I losing connection? Hello, let me repeat that. Our next speaker is the Honorable Hajia Fatahiya. She'll be speaking on the risk of poor menstrual hygiene. Honorable, we are ready for you, please. Good evening.
I'm very much privileged to join this important discussion. Abdul Aziz, and I'm the Member of Parliament for the good people of Salevugu. To contribute to this discussion, I will be speaking on the risks of poor menstrual hygiene. Thousands of women and girls in Ghana face health risks, educational barriers, and stigma due to facilities. There are some risks involving poor menstrual hygiene. Firstly, 58% leading to infection. It will surprise you to know that in a number of rural communities, you will find women using racks, and some even use leaves and other unhygienic materials. Also, the UN and international bodies indicated during their period. And in Ghana, there are instances of a number of students that, when asked why they are not they are unable to purchase or afford.
Excuse me, please, Valerie, could you check? I think Honorable Hajia Fatahiya's volume is very low. We can hardly hear her.
Hello, Honorable. Can you please increase the volume on your gadget, please?
Now?
Yes, it's better now. Thank you so much. Thank you.
Awesome. Thank you. So another problem is that menstrual products are expensive, so they are unable to afford it. A pad costs between 15 to 40 Ghana cedis, depending on the brand that you use and location you find yourself in. The high cost has forced some of these young ones to drop out of school. To address some of these challenges, I am committed to advocating for the government to fully implement its free sanitary pads in schools. The government launched a program in April this year, and I personally wrote an article on it, which is widely published in most of the media houses, and indicated my support for it. And I sought the challenges that I anticipated government might face or confront. I recommend the government for the free pad policy. And another issue is improvement of sanitation facilities in schools. So some NGOs indicated that wash facilities, that is water, sanitation, and hygiene. facilities, and a young girl in school will need those facilities during her period because she should have a place to dispose it and place she can wash during that time of the month. I also intend to promote the menstrual health education, especially in my constituency. I planned having a derby of chiefs and traditional leaders talking to market women about the importance of menstrual hygiene. The reason why they are so is because the government has imposed taxes on sanitary pads or sanitary products. So together with my other colleagues, I Hajia Zuwera, for the removal of taxes so that for women across the country. I also in protection for menstrual girls and women. In this way, stigmatization of girls or women, my colleagues, sisters, let's all work together to dignity and future. Of our women and girls security and to it. Thank you very much, and I am very grateful for the opportunity. Thank you.
uh, 180 plus 240. Listen, I'll send it to you, but I want to be satisfied myself with it.
Hello, Valerie. Hello, Miss Valerie. Okay, maybe co-host Mustafa, maybe you can take over. Probably she's lost on connection.
Yes, I am. I guess so. If our next speaker is ready.
Right. So, good afternoon, everyone. I'm a communications specialist. I'm working with Oxfam in Ghana. Organization. We've been talking about the issue about menstruation, menstrual hygiene, and then the issue about the taxes on the sanitary is to look at menstrual stigma, how to overcome that. Slides, but if not, I can just continue from here. Okay, so it looks like I can share. Thank you. So like I mentioned, menstrual stigma. So I have these two quotes just for us to start thinking about it. And I want to say thank you to the previous honorable speakers. Thank you for sharing those thoughts. And then the lady who spoke, the medical doctor who spoke about the menstrual hygiene management. So stigma around menstruation is a silent barrier to girls' education and women's full participation in society. This is by one of the teachers. And then stigma kills confidence. When society tells you that your period is dirty, you start to believe you are less than others. So, what is menstrual stigma? Menstrual stigma refers to the menstruation. And let me put on record that this happens because people usually don't have enough information about what girls and young women go through when they menstruate. Like has been mentioned by the previous speakers, there have been some instances where, girls, young women who menstruate have to be rushed to the hospital, have to have drip placed on them. And the bit about the trauma, the bit about the discomfort that comes with it, and the bit about the pain that period. And let me also say that menstruation is just an indication that that girl, that young woman can reproduce. That girl, that young woman um, can reproduce her kind, and what society can do best for her within this period is to support her and not to shun her. So we've had many instances where girls and young women who are menstruating um, have been considered unclean because they are menstruating, and usually it can lead to shame, it can lead to them being secluded, and it can lead to them being discriminated, especially with women, young women who are in the career and then the corporate world, where they think that, oh, well, around this time you will not be available, or you probably may be menstruating. So let's give that opportunity to someone else. So let's look at some 5 major causes of the stigma. I mentioned that lack of knowledge. People, especially men and boys, have very limited education on menstrual hygiene and menstruation and all that comes along with it. Our cultural and religious beliefs also hinders people from having very open discussion. And of course, anything that is not discussed is hidden. And once it's hidden, people don't want to talk about it, and it fuels the stigma. Secret, and it fuels embarrassment, and it prevents people from asking questions. There have been several times where to experience it before they ask questions. And unfortunately, some of the times they ask the questions from their fellow friends who may be ill informed. And of course, once they are ill informed, they passed on the wrong information. Then also the media representation of menstruation. Sometimes the way our local radio stations even describe it makes it look very strange and hidden, and it further stigmatizes it. And facilities, the cost of sanitary pad, and even the availability of changing rooms and separate washrooms for boys and girls, for those in school, to be able to have that bit of privacy. Impact. UNICEF says that about 95% of girls in rural Ghana miss school during menstruation. So, of course, if a young girl is being stigmatized because she's going through a natural phenomenon and she doesn't have that support from home, that bit of support, she would think that it would be best to stay away from school. And between 3 to 5 days, or between 3 to 7 days of menstruation means that that girl will miss so much when it comes to her studies. Um, another impact is that it can result in poor mental health. The shame and secrecy can cause anxiety, and then it can also result in low self-esteem. And we've had a lot of instances where girls and young women are restricted from taking part in social and religious activities because they are menstruating, with the idea that you are dirty, the blood you are passing out is dirty, it's unclean. So you are asked not to touch anything. You are asked not to touch the Quran. You are asked not to perform any religious activities until you are done, and some sort of purification is performed before you can be accepted back. And then, of course, another impact also is that for girls who may have challenges with their flow. We've had records of people not having regular flow for a month or 2 to 3 months, and because of the stigma around it, they may not be able to open up to talk to anybody around it about it. And when that happens, we all know that it can lead who has not involved herself in any sexual activity can quickly report, and then the necessary health attention can be provided to that young girl before it becomes something else. So, some quick recommendation. We want to ask everybody on this call, our honorable members of parliament, and then all the young people on board, to at least find one young girl, one young woman you can educate. And in our education, we should, so that within that period, our chiefs can ask questions and then understand, and it can reduce the stigma. And then, of course, we also are looking forward to taxes being taken off from the sanitary parts. We are happy government is into off, so that every girl, those that are not covered under the policy, can be able to buy these products and be able to menstruate in dignity. And then we also want to ask that for our journalists, for our media persons or personalities, they should be able to talk about it so that it can help reduce. When girls are equipped with knowledge and resources, menstruation becomes a time of empowerment, not shame. Breaking menstrual hygiene starts with conversations. Silence is not protection, it is part of the problem. And then the last but not the least, we need to change. We don't need to change the girls, we need to change the conversation around period. The moderators. Thank you.
Thank you very much, Doc. Let me quickly say this, that we are very sorry for the interruption, that very short interruption. It was due to a technical glitch. That is why we lost connection with Madam Valerie. But hopefully we have been able to re-establish connections with her. So sorry for the inconvenience caused. Madam Valerie, over to you.
Thank you, Mustafa, for doing the needful and standing in my place. Okay, so all too soon, we are done with presentations from the various speakers. I request so I am currently going to the comment section, and then I would address I would take the questions in 3 tranches. And then any of the speakers can help us answer those questions. Thank you. So I have one from Laurentia. She's saying, please, I need to address the issue of providing some materials to my school. Is it true that when all the menstrual blood menstrual blood don't come out? I'm reading a verbatim. You are at risk of developing fibroid. Doc, I think you'd be in the best position to take this. She's asking that if the menstrual blood doesn't come out, are we at the risk of developing fibroid?
Thank you, Madam, for the question. First of all, let me go to the issue of all the menstrual blood doesn't come out, because this is an issue that challenges and causes a lot of distress for some women. Okay, I am just trying to get an image now that would show the fibroid, but let me go ahead and mass. It's like a tumor. Okay, now this tumor that tissue. okay, and some fibrous tissue. Depending on where this mass sits, whether in the womb or, okay, I think I have the image now. It would make it easy to explain. Whether in the womb or outside. Please, can you see this image here? Okay. So if we remember the previous diagram of the womb, okay, now some muscle layer of the womb, okay, so we can see the bring the blood out when you're menstruating, and then also contract when you're during delivery to labor. It's common in position or people who have long exposure to certain hormones. Okay, so let's say that's why sometimes the issue of if you don't have children early, it means that you get exposed to some of these hormones that are suppressed in level during pregnancy for a longer period. So we have the risk factors, but the actual cause of fibroids is not known. So you can imagine that instead of these muscles contracting well to stop bleeding or to pass out the menstrual products when you're menstruating, you have this mass now sitting here. So naturally, the muscles will not contract well, which is another reason why when people have excess of in those who have fibroids, which is why they tend to believe, because it happens over time. Before this woman will go and have a scan, see a doctor, and realize, oh, this is happening because of fibroids. So that person's period, instead of 3 to 5 days, is now lasting for maybe 2 weeks, 3 weeks. Some people can bleed the whole month. So it's not because the blood, all of it didn't come out, which is what has formed the fibroid. At times, the fibroid itself being there is why the blood flow is continuous. But it's just because of the menstrual flow, or you feel the blood is not coming out well. It may also be due to other swellings that develop in the women's reproductive systems a long time. But we have things like what we call, but some women develop it along life, and then it disrupts menstrual flow. So it may also cause prolonged flow. Some people, even for some women, maybe their hymen. Everybody has a small hole in their hymen that allows menstrual flow to pass. Is the flow of what's it called, the menstrual products, which is why it may go on for a number of days. So no, if the blood is not flowing well, it doesn't mean that it stays back and then it now forms a fibroid. That blood that you're seeing is made up of the lining and then some blood products and tissues. The fibroid that I'm showing you in a diagram here, for example, is muscle and fibrous tissue. So even the composition is totally different. I hope I've addressed your question. Thank you.
Thank you, Doc. We also have another question from Adam Usman. Oh, wow. Please, is it normal for someone to menstruate twice a month? Doc, let me just add 2 more questions. Then we also have from Wanda Genya. Why do some ladies always have their menstrual cycle changing? Not regular duration or not regular flow. Why? So these are the 2 questions we have. We also have a suggestion from Emmanuel Nyante. Please, can the documents be shared so we can also educate our rural teachers to know more? Let me say that all necessary documents from all speakers will be passed on to you by Mustafa, the coordinator for YIP. So in good time, I'm certain he will update your pages with the slides from all the speakers. So Doc, the 2 questions. Let me repeat it again.
Oh, no, it's
Please.
fine. I've written it down. It's
Okay, that's fine.
So
Thank
the
you.
easiest will be the last question. Yes, I will give the slides I will share with Madam Valerie so she makes it accessible to all who want it. The first is, why do some women menstruate twice a month? So a normal menstrual cycle, okay, is 21 to 35 days. Yes, majority of women sit around 28 days, but if a woman menstruates every 21 days, it's perfectly normal. That's her cycle. So you can imagine that if someone has menstruated on the 1st and she's one of those, 21 days time will be 24th or let's say 25th. So in that case, you will have such women who menstruate in quotes twice a month, but that is because of their cycle length. What we know as 28 is for most people, the majority, but some women sit at the ends of the spectrum. So in the same vein, imagine if someone's cycle is every 35 days, it means that that woman tends to go for more than a month before her period comes. That is also perfectly fine. So yes, it's normal for some women to menstruate twice a month. The second is changing menstrual cycle. And you normally experience this at the clinic for young females who have just hit menarche. So they've just started menstruating and they are anxious. So most people expect that their periods come probably, if it came on the 25th of February, it's supposed to come on the 25th of March. But when we are talking about the regularity of a cycle, we are referring to a number of days. Bearing in mind that let's even take February is 28 days. Some months are 30 days, others are 31 days. So what that means is that even if your period is every 28 days, it doesn't mean that it is supposed to start in quotes on the same date, or should I say the same day of every month, so 26th. So if you had it on even the 15th, in a 31-month cycle, it means that most likely the following month, maybe yours would come on 13th or 12th. So it's more important to pay attention to the number of days rather than the ordinal, which is whether it's 21st, 22nd, 23rd. It's a common concern, but in most cases, it's a perfectly normal cycle. Thank you.
Thank you so much, Doc. Okay, we have another question from Kendall Elizabeth. What should one do when pain relief medications or heat pads do not stop your cramps? So she's talking about menstrual cramps.
Okay, thank you. So as for pain relief and then or pain management with menstruation, it's a very, very it has so many causes. So what I would say is if somebody has tried the basic over-the-counter medications and some of these other alternative therapy treatments, maybe some juices, vegetables, people have different things that work for them when they're menstruating, some teas and it's not working, please just come to the hospital and have it checked first, because it may even be due to fibroids. That is why you're having the painful periods. So come, let's have it checked. Once we have it checked, then we can move to further pain management of menstrual cramps. But the good news is, in present times, there are so many alternatives for management, pain management in cramps. So it's not expected to be, as debilitating as previously, such as the person has to stop maybe activities of daily living because they're in their periods and it's as though all hell has broken loose. I would say if you've done the basic over the counter and it's not working, please just see a doctor to proceed with management. Thank you.
Let me also add that comprehensive education on this subject matter, especially in Ghana, is lacking. So we are very, 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 very grateful for all the questions coming through. I have another question, Doc. It's from one of our students. Can bacteria in menstrual blood cause infection? And then there's another question from Emmanuel. When a girl normally, let me just read it. He is asking about the period duration, 5 days. Okay, I think I do understand the question. So she's asking that when a girl normally has a period for 5 days and going forward, the duration changes to just 2 or 3 days. Is it a normal occurrence? And then he's asking why and what is the cause for such changes in terms of the period duration.
Okay, thank you. So the first is if the menstrual flow can cause bacterial infections. Yes, it can. You remember, even in my presentation, I spoke about infection predisposition for people who use invasive menstrual products like a tampon and it stays in too long. Because imagine that blood in itself, which even as humans need to survive, it's also very good culture medium for a lot of bacteria. Remember also that a lot of these, some of these, what's it called? Products. One of the risks with the menstrual products is that we are introducing external things to collect this blood. And these external things stay in contact with the body for a long time. So it's perfect for bacteria growth. That's how come menstrual management, which is the hygiene and safety concerns, are very, very valid to address, because infections can arise when you don't manage menstrual flow properly. The second is the duration of menstrual flow. So normal menstrual flow can even be 1 day. Yes, if you are menstruating for 1 day every month or every period or every cycle, as long as it's regular and the flow is coming, the duration is not particularly concerning. The reason why someone's period may change from 5 days to 2 days, it may be hormonal changes as the person gets older. It usually has no issues, or it doesn't translate into any fertility complications. And to be honest, I mean, it's a common thing that comes up when patients come to the clinic to complain about this. That's really bleeding more does not mean anything. It doesn't have any extra benefit. And you realize that even for most women, as they get older, the flow gets lighter to the point where sometimes they even begin to skip some months. So even at the peak, if you are 25 and at 18, you were bleeding for 5 days and now you're bleeding for 2 days, there's no concern. If it's coming cyclically, you don't have to worry about it. It's fine. And I've explained the causes too. So I think that's it. Thank you.
Doc, I like your submission on bleeding more doesn't have any added benefits. Yes, I really like that, because looking at the questions coming in, people are concerned about their menstrual duration. Let me say that the primary objective for this engagement is to demystify menstruation, dismantle harmful myths and taboos, and equip our women in the Youth Impact Parliament with accurate information and practical skills regarding their menstrual health and hygiene. Okay, I have a question for Hajia, Honorable Hajia Fatahiya. The person is saying, I saw your publication in the Ghanaian Times after the government launched ensure that the pad gets to every girl child in the country. I do know that the pad is directed to students, but let me leave this for Honorable Hajia Fatah to answer. Thank you. Honorable.
I am going to use my influence as a member of parliament to ensure that all girls in my constituency get the parts as allocated by the government.
Valerie, can you please check the microphone is still low?
Honorable
Okay.
Fat. Yeah, please,
Now?
can you amplify? Yes.
So I may have
A
to
little.
Thank you. I'm going to use my influence as a member of parliament to ensure that all girls in my constituency get the parts as allocated by the government. And also, as the deputy ranking on gender committee, I will collaborate with my colleague MPs, especially the female MPs to ensure that the product reaches its targeted destination. And I also want to commend Doctor. Thank you. I think I've also gotten some education from your presentation. Thank you so much for the opportunity.
Thank you, Honorable Hajia Fatahiya. Doc, I also have a question. It looks like now we hear of PCOS, and now it looks very common amongst women. Is there any cause for this spike in terms of the number of PCOS cases? And what can also be done to address it? Because it looks like much education hasn't been channeled towards PCOS. And what the students on this platform, can you throw more?
Okay. PCOS is what we call polycystic ovarian syndrome. Okay. And I mean, it's very broad, but I'm just going to summarize it. Itself, we are talking about polycystic ovaries. So everyone's ovaries, I mean, produces follicles, all of that. There are some cysts that develop naturally at different stages, whether you are ovulating, some are just physiological. But in people with polycystic ovaries, they normally present to the clinic and their primary concern is subfertility. They have irregular periods, or at times they have no periods at all, although they've attained the age at which we would expect females to be menstruating. In these females as well, you may realize that some of the features may be weight gain issues, okay? Some of them show up with acne. Some of them have hirsutism, so they have hair, facial hairs. So it's like excessive growth of hair from what we know to be the standard for females. And because of the weight issue, some of them may be obese. Some of them may even show up with some issues with blood sugar control. So they are not really diabetic, but you see some fluctuations in their glucose levels and all of that. And then you do hormonal tests. So when you do the scan, someone comes to you with irregular, you see that they have irregular periods. And then you do androgen hormone assay. Androgen is what's a hormone that we know should be found in males. Okay, so male hormone in areas which is more masculine. So these women have higher androgen levels than normal. The management of PCOS, they advise correct all these fertility and what's it called, irregular period symptoms they are experiencing. So healthy diet, regular exercise, weight management alone is able to manage this in some cases. Some may require birth control to regularize their periods. So, you know, birth control, the ones that people take for 30 days, you see 21, even on the advert on TV, adverts like Secure, you see 21 tablets of a particular color. Then at the end, you see these tablets that have a more brownish color. So it's normally when you take when you're taking the 28 tablets, when you get to the last cycle, the last line where the tablets have changed color, that is when your menstrual flow will come in. So for some of these women, we put them on some of these tablets just to try and regularize the cycle. When you do it for a while, maybe about 6 months, and you stop, in some cases, it's able to reset the menstrual cycle to permit normal flow. Some require diabetic medication to control their sugar. Okay. Some may also require some support with fertility, some treatments to manage it. So it's a syndrome. Besides the fertility, maybe the excessive male hair features, weight gain, and other psychological issues. Naturally, that'll be associated with all that I'm saying. The female is having weight challenges. Her periods are not coming regularly. She's having facial hair growth like a male. So that also comes with a lot of psychological issues. But once these are addressed, it's compatible with life. They are able to reproduce with some assistance, and then life goes on. So this is PCOS in a summary.
Thank you, Doc. Let me just also say that the subject matter of menstrual hygiene and health is very broad. So there's a need to equally bring on board men to educate and enlighten them about menstruation to help reduce stigma, foster empathy, and encourage support. Based on these words of mine, I have one male, I think a man, who wants to ask a question on the notion of intake of post pills causing changes in menstrual cycle. How true is it and why? Okay, he said, I'm asking as a gentleman. Thank you, Richard. Then, Doc, let me just add the last two questions and then we can call it a day. And then let me also say that such engagement activities and projects will be ongoing so that we can correct some of these myths. So rest assured, Youth Impact Parliament, we would be coming up with such entertaining and educative sessions on menstruation, reproductive health, so that we can address all our concerns. The last two questions, aside pregnancy, what else can stop a girl from seeing her period? That's from Laurentia. And then the last one is from Emmanuel. Please, can hormonal fluctuations during menstruations contribute to fibroids development? It looks like Emmanuel is very concerned about fibroids. Thank you so very much. And Doc, these
Hello,
are the
Valerie.
last questions. Thank
Hello,
you.
Miss Valerie.
Yes, please.
There are a number of questions on our Facebook wall. I don't know whether you have attended to them too.
Mustafa would address those questions, please.
All right.
Mustafa, yes, please.
That's
Doc,
good.
let me take the last but one questions. Thank you.
Okay. Okay, so I'm reading that. I didn't catch, you said? One question you read before about
Development.
no before is causes fibroids.
I have another. The notion of
Yes, I got that
that.
one.
You got that one.
Yes, and then
Okay,
after
so
that, there's another one.
okay, Laurentia said, aside pregnancy, what
Okay.
else can stop a girl from
Okay,
seeing
yes,
her
that's
period?
it. Okay, so let me start with the emergency contraception. So, you know, for emergency contraception, okay, the main mechanism by which some of them work, okay, so most of them are hormonal. That's what we need to understand. So that during a certain period after sexual intercourse, after which its effectiveness is significantly low. Okay, so what it may do in some cases is it may delay your period by a few days because it delays ovulation. For some, it may affect the lining of the uterus, okay? And because it's hormonal, it can also cause some temporary hormonal spike. So what is that it goes, when it's taken, it confuses the body a bit. Let me put it that way, okay? So it may need to some even earlier shedding, so everything comes out before. It may prevent implantation. There are different types. So naturally, once a woman has her normal cycle, we have the period when you're shedding the lining. We have the period when you're supposed to be ovulating. We have the fertile period, and you probably had unprotected sex, and you want to make sure, okay, that an egg is not released to come and meet the semen or the sperm in the uterus. So because of that, you are disrupting the cycle because you don't want that. In some women, it would what's it called? It will affect the menstrual cycle. I mean, I hope this is clear. Okay. The reason why we are taking the emergency contraception is we are trying to prevent the normal process that may have led to a released egg being fertilized by the sperm in the semen from happening. So once you're doing that, it means you're affecting the cycle in some way. Some women may get away with it in the sense that maybe you had it at a time where it was even your very safe period to start with. Probably you've even just menstruated just the day before, but you just decided, maybe your menstruation ended the day before, but you just did that as a secondary measure. So in that case, there's really no extra lining to be shed anywhere, or there's really nothing to prevent period, you see. But when you take it at a time where it has to work by preventing the implantation, okay, then in that case, you are going to disrupt the cycle. So yes, 3 months after, up to 4 months after, usually it picks up by itself, the cycle, after a while when it settles. Is to reset. So we just do, you are pregnant and it will return in some weeks. The other question is, aside from pregnancy, what may stop a girl from menstruating? So as for the things that stop menstruation, I mean, it's a lot. We cannot even spend, we can even spend the next 2 or 3 hours digesting that alone. But in summary, what I will say is that even for some women, okay, there's somebody that if they left home and went to a new work environment, they went to a boarding house, you'll be surprised their periods, because of the psychological stress or just because of the environmental change, that alone can stop somebody or cause somebody's period to cease for another 3 months. Medications can affect a menstrual cycle, okay? And then some hormonal imbalances, some other medical conditions can also affect a menstrual cycle. So as to things that can disrupt it, so many things. And of course, pregnancy in itself can stop a girl from menstruating. So it may be psychological, it may be pathological, it may even just be because of the body is stressed or has not settled. Okay, thank you.
Thank you, Doc. Let me take the questions from Facebook. We have one from Abna Asiedua. I think you have answered and belabored the point on the duration, menstrual duration. So I would skip that. We have one from Princess Lovia Tete. She's asking whether overusage of contraceptive pills can affect the menstrual cycle. And then finally, we affect the normal flow of menses. So we have these two questions on overusage of contraceptive pills. Thank you so much, Doc.
Okay. So I think with stress and fatigue levels, I even mentioned work stress, change stage affects on the menstrual cycle, because they are designed such that, and then I described it earlier, that normally it comes as a pack of 28 strips. So they are designed to simulate the menstrual cycle. Those are the ones that some women opt to take every day. So you'd realize that for 21 days, you would be taking that contraceptive pill daily, okay? Then there's a break in it. So you realize that the last 7 tablets, which is what you normally take from days 22 to 28, that's the last 7 days. Those ones are usually just iron supplements to boost your blood. That's what most contraceptive manufacturers do. So you realize that after you've taken the combined pill for a while, you have the effect of thickening the uterine lining, thickening it. Then when you withdraw, after that 21 days, you don't even know you've withdrawn, but it's just the way the tablets are designed. So that hormone is taken away, and it's just iron you take for 7 days. So you'd realize that some of those, the combined oral pills like Secure, rather regularize your menstrual cycle properly for most of those who take it, because it's designed to thicken the uterine lining for 21 days. And then the next 7 days, it ensures you shed it. Then you start again next month, you thicken for 21 days, you cut off the next 7 days, you shed it. A lot of the hormone disruptions come with the progesterone ones. So those are the things like the 3 monthly injectables. And sometimes for some women who use the hormonal implants, they develop some disruptions when they decide to discontinue the the use of the contraceptive product. I must say that there are instances where someone can take a 3 monthly injectable. They took a single one, which is supposed to last for 3 months. They probably did not continue after the 3rd month, which means that they didn't go for a repeat jab, but they may end up menstruating the very next month, or for some women, the periods may delay even for up to 6 months after. It's not common, but it happens. So yes, contraception, depending on the type, can affect menstruation. It can cause delays in the menstrual cycle, but usually after a period, it reverts to normal. It's just that naturally there's a lot of anxiety where you probably just meant to take that depot injection for 3 months. You are probably ready to now get pregnant after 3 months, but your period is not back because all the hormone deposit has been designed to sit for 3 months. Sometimes you can appreciate that for different people, absorption and its effects may vary. So the effect may be longer for some people. In the same vein, that's why we have some contraception failure. Some women take it for 3 months, but it may not be effective and they may end up pregnant. Those are the ends of the spectrum. So they are not the common things that happen, but in some cases they occur. Thank you.
Thank you so much, Doc. We have some comments. I have one from Wanda Genya. He's averting our minds to the fact that more men are equally part of this discussion. Thank you, Wanda. And then we have a comment from Kendall, appreciating the men supporting the women when it comes to menstrual hygiene and menstrual health, and then helping to demystify the whole myth surrounding it. Okay, thank you so much. Thank you. I would want to firstly thank all the speakers for their insightful presentations. And let me call on my colleague Eresi Dankwa to do the needful in giving us a vote of thanks. Thank you.
Thank you all for being part of today's important program, that the theme, Prioritizing Women Health for Inclusive Democracy. I must admit that your presence and active participation have made this event a very resounding success. We are deeply appreciative to our distinguished speakers, participants, and the vibrant young women from the various tertiary institutions and who share their experiences, insights, as well as the comments and the questions. A sincere thanks to the Public Engagement Departments of Parliament of Ghana as well, and the team that were dedicated in making this program possible. Your hard work and commitment to supporting young women and girls' health and leadership is truly commendable. Most importantly, let's carry forward the lessons, the experiences, and the knowledge shared in here to continue to build a more inclusive and healthy society for all, especially women and girls. Once again, thank you all and have a good evening.
Thank you, Madam Matilda Eresi Dankwa, for this vote of thanks. I will call on my co-moderator, Mustafa, to give us his closing remarks. Thank you.
Thank you very much, Ms. Valerie. I would like to say that we have drawn the discussion to a close, and I would like to take a moment to acknowledge and appreciate all our panelists, Hajia, Zuwera, and our two Hajias, Hajia Fatahiya, and also Dr. Demfi and Mr. Archibald. We are so grateful for the insightful contributions, and your perspectives have truly enriched this session, and we are grateful to have your time and efforts. Thank you so much.
Thank you, Mustafa. Let me also commend the Director of Public Engagement for always continually supporting our parliamentary interest groups. Director, we are grateful for investing in student leadership. We are grateful. Thank you so much, and let's all enjoy our evening. Thank you.